Access to health services without discrimination is key to having a healthy society and citizens that can actively contribute to the country's development. Here are some examples of the WASH projects supported by World Connect. On our trip to Mzuzu City, we went to Nkhorongo Township, where the community has made strides in promoting healthcare provision and making access to treatment easy for people living with HIV. At Nkhorongo Health Center, lack of a conducive ART clinic caused a high default rate among adults and young people who are on antiretroviral therapy in the area. Using $9,850, World Connect partnered with Action for Sustainable Development, ASD, and communities around Nkhorongo to construct an ART clinic in the area that has changed the narrative. Thomas Ngwira is ASUD Executive Director and World Connect's established field partner for the project.
There was a time when people living with HIV and AIDS, including the children and the elderly, the older people, we had a meeting plus everyone. So in that meeting, we have our own way of capturing the necessities or setting up priorities or taking up the visions from the community. On summary now, it was found that from the list, the top was construction of the ART clinic, looking at the position where it was before along the road, where there was no privacy.
This clinic alone is supporting over 3,500 people in Nkhorongo to receive their ART services in a safe and confidential space.
The big thing is the support we received as people who are taking ARVs. We now have a conducive space to access treatment and counseling. Before the clinic was constructed, we were using a house that is along the road, which was not comfortable for most of us. This led to a high default rate in our area. But with the clinic, it has helped us access treatment in a safe environment.
While there, we observed people of different age groups coming in to access services at the clinic, confirming its daily use. We also traveled to Nchisi in the area of Sinyo Chief Malenga, where World Connect partnered with Environmental Water Sanitation Foundation, EWS, to promote access to clean and potable water in response to community needs. With a $3,726,000 grant, 1,200 individuals in Nchisi now have access to clean and safe water sources through protected wells, a scenario that was not evident prior to the project, as both humans and animals were drinking from the same water source. This intervention has reduced both the spread of waterborne diseases and the distances that women used to travel just to fetch water. Alimet Banda from Kamazinda village explains how the project they initiated has changed the lives of the people in the village.
We had a lot of problems with accessing clean water. We were using wells that even animals use. We thought this problem will never go away. But now we are happy as we have access to clean water, and now it's also helping us to improve our hygiene to prevent COVID-19.
Harvey Mayembe is the programs officer at EWS.
This grant was focusing on the improvement of water provision in the rural communities. As you know, EWS, we are achieving SDG number 6, which is talking about the provision of potable water and good sanitation to the rural communities.
These stories of joy from Nkhorongo in Mzuzu after construction of an ART clinic and Kamazinga village in Nchisi after getting access to potable water are evidence of what small investments and quick implementation can do in communities that have ownership of the projects. Our visit came more than a year after implementation, which confirms sustainability of the project interventions. In total, 3,500 people are now using secure and confidential spaces to access HIV/AIDS and antiretroviral services. Over 12,800 people, including children and women, are accessing under 5 and family planning services within their communities. 23,220 people have obtained access to clean and safe drinking water, reducing recurrence of waterborne diseases and positively impacting the development efforts.